Good morning and welcome, everyone. It's my distinct pleasure to share my experience as a global health practitioner working in AMR. Over the past 9 years, I've been immensely fortunate to be able to learn through the practice of healthcare provision and research in Latin America and the Caribbean region. I'm from Belize, so for my own personal and professional interest, I hope to contribute to this space for as long as possible. And I'm so honored I've been invited to share a few words of introduction in this distinguished health forum. I've now placed here in my backdrop an image that was submitted by a medical student in Belize for the National One Health Committee's video poster competition during World AMR Awareness Week in 2022 entitled Belize is Antimicrobial Aware. In his own way, the student demonstrates the extended, multi-layered, and complex epidemiological and evolutionary scenario of AMR that has led us to this moment. A moment where, unfortunately, antimicrobial resistance is an increasingly severe threat to health worldwide. So I always think it's important in these settings to take pause and remember the remarkable work of Sir Alexander Fleming, who discovered penicillin in 1941. On receiving the Nobel Prize in Medicine, he urged caution on its use in this way in 1945. He said, "The time may come when penicillin can be bought by anyone in the shops. Then, there is a danger that the ignorant man may easily underdose himself, and by exposing his microbes to non-lethal quantities of the drug, make them resistant." Of course, alarmingly, the first case of penicillin resistance was discovered only 2 years later. We who are in the curing business appreciate the value of penicillin, which dramatically transformed the trajectory of modern medicine. It and the antimicrobials discovered in its wake are curative drugs. Penicillin, for instance, in just under 30 years, increased the survival rate of bacterial pneumonia from just 10% in the black curve that you see on your screen to 90% survival by 1964. So AMR puts extra pressure on the health community and it prevents us from doing our job of saving lives because antimicrobials are a prerequisite in any modern day healthcare setting. For the first time in 2022, we have comprehensive evidence that shows that AMR is a leading cause of death globally. In the Global Report on Antimicrobial Resistance, or the GRAM study, 4.95 million deaths were associated with bacterial AMR, with patients in low and middle income countries being 1.5 times more likely to die of it compared to those in high income countries. This makes AMR the third leading cause of death amongst the global burden of disease level 3 causes, behind ischemic heart disease and stroke. And 1.27 million deaths were attributable to bacterial AMR. Finally, 1 out of every 5 deaths associated with AMR occurred in children under the age of 5, with almost all of these occurring in low and middle income countries, particularly in sub-Saharan Africa. Now, those numbers are coming out of 2019, and we all know that just 1 year later, COVID-19 swept the globe. And looking at the experience of Latin America and the Caribbean, we saw 180 million COVID-19 cases and 2.8 million deaths. But with COVID-19 also came a host of other epidemiological crises, such as outbreaks of Candida auris in our healthcare facilities, COVID-19 associated mucormycosis, and the emergence and new combinations of carbapenemases in Enterobacterales in our region. And to say a bit more on Enterobacterales, in this slide, there's an epidemiological study that was done in Argentina demonstrating the proportion of Enterobacterales resistant to imipenem between 2015 and 2020. You'll notice a dramatic increase in Klebsiella pneumoniae, which is one of the critical priority pathogens that causes healthcare-associated infection and is described in the WHO Bacterial Priority Pathogens 2024 report. So the question remains, was there evidence to use these antimicrobials to that extent in COVID-19? Well, the short answer is no. I encourage you all to read the full report published in 2021 by the Pan American Health Organization and partners on the impact of COVID-19, specifically on Enterobacterales. In one of our Caribbean islands in 2020, during the height of the pandemic, they coined a slogan, "Beat Back COVID." And it's very true. Whilst we're battling against pandemics like TB, HIV, and COVID-19, we mustn't forget its cousin pandemic, antimicrobial resistance. It is essential that we do not lose sight of long-term AMR priorities. And so in this slide, I want to share 5 effects of COVID-19 on antimicrobial stewardship, which is the safe and appropriate use of antimicrobials. Firstly, COVID-19 exposed rampant antibiotic overuse. There were early antibiotic prescriptions, and persons in the general population were self-administering antibiotics prophylactically. And we all know that misuse and overuse of antibiotics is the main driver of AMR. Secondly, whether it be because of insufficient human resource preparedness, reassignment of staff, or loss of staff, there were breaks in infection prevention and control. We also saw an overwhelmed laboratory capacity, sampling limitations, and reduction in AMR surveillance programs. Ministries of health and government had to shift priorities and reallocate key resources to the pandemic response. And an overcrowding of healthcare facilities may have led to an increased healthcare-associated infection and spread of resistance. But to end on a positive note, I want to reemphasize that once we remember these challenges, there is an opportunity in COVID to optimize on strategies that we are so much better at implementing and learning from, such as the regular upskilling of medical staff in infection prevention and control guidelines, learning from the vaccination rollout, the use of online resources to seek evidence in practice, and improving strategies for community education to beat back the infodemic. Of course, more investments are needed to develop better vaccines, diagnostics, and antimicrobials. And now more than ever, there's a culture of knowledge exchange and sharing. There are open and free resources for all researchers, healthcare and laboratory teams, and organizations working in AMR research to use these tools to establish an enabling environment for stewardship. So I have touched on some, but certainly not all of the themes in this rich discourse that we can foster in this forum. I am so happy to contribute further, and do connect with me and let us continue to exemplify truly inclusive leadership through global harmonization and exchange. Thank you all so much, and take good care.